Hi everybody, so my name is Giovanna and I'll be talking about Mycobacterium tuberculosis. So Mycobacterium tuberculosis belongs to the domain bacteria. It's part of the genus Mycobacterium and part of the genus, they can cause disease in mammals. And the name myco means fungi and that refers to the colony shape that you'll see later on. It's an obligate arrow, so that means that it needs oxygen to survive. And as you can see here, it's basilis or rod shaped. It's about 2 to 4 micrometers in length. And as you can see here in the scanning the electron photography here, uh, you don't see a flagellum, so it's not mobile. And also, it's non-spore forming. Most of the cell walls, they're about over 60% lipids. And if you were to dry the cell envelope, 50% of the dry weight will be mycolic acid. So as mentioned earlier, the cell wall of Mycobacterium tuberculosis, it contains a lot of mycolic acid, which is hydrophobic because it's long fatty acids. So that's why it's really difficult for the bacterium to take stains, like a gram-positive or gram-negative. So instead we use acid-fast stain. Usually we'll stain carbyl fuchsin first, that'll stain it pink, then acid alcohol decoralizer, and then we'll use methylene blue. And usually the Mycobacterium tuberculosis will stain pink, as you can see in figure 2. The bacteria is actually singles, mostly single, sometimes double, and sometimes they'll clump together, as you can see here. Something interesting is that Robert Koch was the first to isolate Mycobacterium tuberculosis. And as you can see here, this is actually, there's 2 different mediums that are used currently. The Lowenstein Jensen medium, which is egg-based, and there's a Middlebrook medium, which is agar-based. As you can see in figure 3, they use the Lowenstein Jensen medium, which is egg-based. And usually it will take about 4 to 6 weeks for a colony to be visible. And as you can see here in figure 3, it's rough, raised, irregular, and wrinkled. And also because it takes so long for it to grow, the mediums have to need inhibitors, so that's to inhibit the growth of other bacteria. So the main route of exposure is actually through airborne through droplets. So that means if someone is talking and singing, coughing, or sneezing. Someone sneezes, you'll be in the air for a little bit, and then if you breathe that in, then you'll get no bacteria. And infections, usually infections will go through the lungs and throat, and if it's there, it's contagious. But sometimes the bacteria will grow, and then it'll move to other places like the spine or the kidney, or even the brain, but then it's not going to be contagious from those areas. And as mentioned earlier, Mycobacterium tuberculosis leads to tuberculosis. Usually the symptoms are coughing over 3 weeks, sometimes they're coughing blood or coughing flame from the lungs, pain in chest, and chills and fevers. The treatment is really long, over 6 months, and you need a combination of different antibiotics. The reasoning is that the bacteria has, because the mycolic acid in the cell wall, they make it harder for the antibiotics to act, and you need a combination of those. And the reason why the treatment is so long is because if you have bacteria that are killed, but some of them leave, then they become resistant to the antibiotic. And as you can see in figure 5, usually they know that you'll have tuberculosis by looking at an x-ray. Sometimes they'll do a skin testing, well, they'll do like a little scratch on your arm, but that will only tell you if you have had it. So that'll be if you had latent tuberculosis, meaning no symptoms. So latent tuberculosis means no symptoms, you're not contagious. And tuberculosis is when you have the full symptoms and you are contagious. And usually you can see tuberculosis in an x-ray because it produces kind of nodules, so then they become harder in the lungs. Something interesting is that in the 17th century, tuberculosis was called the White Plague, and it affected 100% of the population of Europe. So 100% of the population was infected, and it caused 25% of the deaths in Europe. And right now, currently, it's the leading cause of death by bacterial infection.